Okay, my name is Sylvia Gandera. I'm from San Dimas, California. I travel 50 miles to come and see you when I come for a visit.
How's the traffic?
Okay, traffic. So today it was good. The last time we had to cancel because I was a half hour late.
Yeah, it happened.
That was bad.
So you started off talking about some jaw pain that you've had in the past. Tell me more about that.
I did. On my right side, decades I've lived with it. Just kind of a pain. Sometimes it would lock. I never chewed on that side because it was just not comfortable. It didn't hurt, it was just not comfortable. So I lived with it, and I've seen dentists, and everybody tells me it's TMJ. I got sent to a TMJ doctor who wanted to do surgery, and I said no. And so I just lived with it until I talked to you. And so you told me about this procedure, and we went through with it, and it worked out really well.
So the pain that you lived with before, so you would avoid chewing on that side.
Always.
So tell me how did that, in daily life, was that an issue, or is it?
It wasn't really an issue because I had become so used to it. So I was always chewing on the other side. But the times that I would notice it is when I would have, my jaw would ache a little bit, or sometimes it would lock. And then I'd have to play around to get it unlocked. And those were kind of the little things. Occasionally I woke up with headaches at the base of my neck. That may or may not be a result of this, but I haven't since we've had this procedure done. So
how has it changed now that things have been worked on?
Really, really good. I really don't notice anything because I don't feel anything. So it's really nice. It's really nice not to deal with it. The one issue I had was getting myself accustomed to chewing on that side, because I found I was chewing over here and I thought, oh no, I can chew on this side now. So I've kind of worked that out.
Yeah, that's good. That takes time to break those habits.
Oh yeah, it does.
But now, so you've noticed that you haven't had any headaches at the base of your skull?
No, I know I mentioned that to you, and you said that may or may not be a cause of that, but I haven't had any, so I'm really happy about that.
Yeah, better to not have it.
Yeah, exactly. And actually I used to get, sometimes those would result in migraines, and so I just thought I had migraines, and I don't know. It may be, it may not, but since I've had this done, I haven't had anything. Very comfortable.
Good.
Yeah.
Talk to me, how was the treatment, going through the treatment?
Oh, it was painless. It was really actually interesting because I like technology and that type, so I was able to watch with Dr.
Kirsty.
Kirsty, yes. I was able to watch the transition from the stress level on my jaw before we began and the unbelievable difference once we got through the first treatment there. The relief of stress on the muscles around my jaw. So it was really interesting to look at. The doctor,
Kirsten.
He was pretty amazed at how much stress I was, and was surprised that I wasn't in constant headache mode. So that was really interesting. I liked it.
Your muscles were way out of whack.
They were crazy, and it wasn't you telling me that. I was looking at it on the monitor there, so it was amazing. Yeah, I like that.
Yeah, no, the technology's great. Without it, we wouldn't even know how far your muscles were out of whack.
Oh, exactly. And it was really funny. On the way to the treatment, I was listening on the radio to TMJ doctor. He was talking about this, wasn't talking about that treatment. He was talking about what he can do for you and everything other than what you did.
Yeah.
And I thought, oh my gosh, that's just, it wouldn't work. This worked.
Yeah, so this was something easy.
Very painless. It was easy. It was the only thing I had to get used to was biting on my right side again. Being able to use it. That was it. It was great. I liked it.